Well, thank you very much, and good morning, everyone. It is a pleasure to be here at Mortal and Pestle and a wonderful community pharmacy right here in Toronto. Thank you for welcoming us today and for everything you do in your local community. On behalf of Premier Ford and our government, I want to offer our appreciation to our province's pharmacists, clinicians, and all healthcare workers. We saw how pharmacists play a critical role administering vaccines to Ontarians in their communities. And we are very grateful that you are a willing partner in ensuring Ontarians can access healthcare in a very convenient way in their neighborhood. The best way for Ontarians to stay healthy as the weather gets colder and to protect one another from COVID-19 and the flu is by staying up to date with your vaccines, which includes both your flu shot and your bivalent COVID-19 booster dose. A healthier population that is protected against respiratory illnesses will mean fewer hospitalizations, to allow hospitals to continue to provide care to those who need it most. Today, I'm pleased to announce we are taking another step to make it more convenient and faster for Ontarians to access care. Starting this Monday, December the 12th, pharmacists will be able to prescribe the COVID-19 antiviral treatment Paxlovid in local pharmacies across Ontario at no cost to the patient. By increasing access to these treatments in more convenient ways, we are helping to keep people healthier and reduce COVID-19 related hospitalizations. Paxlovid prescriptions will remain available through other channels with our primary care providers and clinical assessment centers. This change will expand access and offer increased protection to our most vulnerable and mitigate pressures on the province's hospitals. Vaccination continues to be the most effective way we can protect ourselves and our loved ones from the most serious effects of COVID-19, as well as the flu, which is why healthcare professionals continue to strongly recommend that all Ontarians stay up to date with their COVID-19 vaccinations, get your flu shot, and wear a mask indoors in crowded settings. When we are all working together to make and accessing healthcare easier and more convenient for Ontarians, the whole healthcare system benefits from this collaboration. Thank you again for welcoming me here today, and stay well. I would now like to turn it over to Justin Bates, CEO of the Ontario Pharmacists Association.
Well, good morning, and it's such a delight to be here. This is a fabulous community pharmacy serving patients as a healthcare community hub, and I want to take this opportunity to thank the Deputy Premier and Minister of Health, Jones, and the government for recognizing the role and the value that pharmacy professionals play every day in expanding access to what is a very important treatment for COVID symptoms called Paxlovid. This is something that we build on the work that we've been doing for the last several months in dispensing Paxlovid and dealing with some of the complexities and the drug-to-drug interactions, which really leverages the pharmacist's expertise, training, and education. Now we can reduce the barriers to make sure that more Ontarians have access to this important medication. And what we're trying to do with all of this is work together in an integrated fashion with all of the healthcare providers to make sure that Ontarians can get the medications they need when they need it. And what's really important is to continue to work collaboratively with government and all stakeholders to come up with solutions that create capacity in our healthcare system. We know that by using Paxlovid within 5 days on the onset of symptoms, that we can prevent severe symptoms, and our ultimate goal is to prevent hospitalizations. And by doing that, we release some of that burden in emergency departments, in hospitals, and ICU units. I also want to take the opportunity just to say how proud I am as CEO of the Ontario Pharmacists Association, representing community pharmacists across the province who have really stepped up and provided solutions to this healthcare crisis. They've been doing vaccinations, testing, and continuing as community healthcare hubs to serve their patients and help manage their health. You know, we're going to continue to work collaboratively with government on issues around prescribing authority and other potential opportunities to give patients more community-based access to care. And we know this can be done, as we have seen in other provinces and as we have seen in Ontario, safely and effectively. So once again, I thank the government for recognizing the role of pharmacy professionals, and we look forward to successfully implementing this program, providing pharmacists with the tools and resources they need to be successful in optimizing this in their pharmacies and serving Ontarians across the province. So thank you.
All right, we'll now begin to take questions from the media. If media could form their best line they can behind me in the scrum mic. As a friendly reminder, the format is one question, one follow-up.
Morning, Minister. Liam Casey with the Canadian Press. I'm just looking for a bit more details on the Paxlovid program, like how much it's going to cost, the uptake so far. Are you pleased with the uptake, or is this related to trying to boost the uptake of Paxlovid?
It's really about accessibility. So currently, we have a situation where in Ontario, pharmacies are dispensing Paxlovid, but they are not actually administering it. There are approximately 4,000 pharmacies currently that are doing that. And while it is a voluntary program, we are quite optimistic that there will be many pharmacists that choose to do this because it is another pathway for them to assist their patients directly. So it's really about getting access into community faster. As Justin mentioned, you have to administer Paxlovid within 5 days of experiencing symptoms. So it's really that access that we're improving.
Hi, Minister, or Justin maybe, around the corner. I'm not clear on how many pharmacists are actually going to be doing this, because the Minister was saying they can opt in. So there's 4,000 pharmacies, just trying to avoid a situation where people start popping into pharmacies and expecting Paxlovid to be prescribed on the spot and can't get it. So how do pharmacists opt in? How is this going to be communicated? Or do they just have to decide, yes, I want to do it, and send in a form?
Great question. And one of the things that we're going to do as the association is to support them with all of the communications, tools, and resources they're going to need to implement this in their community pharmacies, including some additional education, CE training that we're being made available. So as of today, we will be sending out a communication that talks about the program, builds on the success of the dispensing element of this that we've been doing for several months. And our expectation is that the majority of pharmacies will take this on, but they'll have to look at their patient population and individual circumstances to make that determination, and we'll be with them walking side by side to help them.
So will pharmacists be deciding over the weekend whether they're going to do this, or, what can people expect on Monday? How many pharmacists might actually be doing this?
Yeah, I don't know if we can give an exact number at this point. We'll be communicating with all of our members in the broader community pharmacy sector on the details of the program and what the expectations are with the policy guidelines and the funding that comes with this. So that will, I expect, encourage people to participate. And I think you'll see the majority step up, as they have throughout the pandemic, to provide solutions and help their patients, because we know just how important this treatment is to preventing severe symptoms and avoiding hospitalizations. So like pharmacists have done throughout the pandemic, they will continue to step up in this manner.